Hi, I'm Robert Demeff, a physician with Texas Orthopedic Associates in Dallas, Texas, and I want to talk today about shockwave therapy. Shockwave therapy is another one of these techniques that we refer to as regenerative medicine. Now, the basic physics behind shockwave therapy are that we deliver a high energy impulse to a tissue that causes tissue damage that stimulates a healing response. The way it does this is by rapidly increasing the pressure in the tissue. It's a very high peak, it's very short-lived, and then this is followed by a negative pressure effect on the local tissues. And so what happens is you develop damage to the tissues by direct effect of the pressure or by indirect pressure. And indirect pressure is that vacuum effect that occurs when there's a negative pressure in the tissue that the cells will expand and rupture. So you have two ways of damaging the cells, and that leads to tissue damage resulting in a healing response. The other thing that occurs with shockwave therapy is that you'll develop microbleeding or hematoma, and that also contributes to the healing response by bringing the blood there. So the theories of action of shockwave therapy are, first of all, this direct cell damage releases growth factors that stimulates the healing response that we're trying to achieve. The second is the microtrauma also seems to promote neovascularization or new blood vessel growth to the area, and that also results in a healing response. And the third theory of effect is that the shockwave therapy causes a change in the nerve receptor sensitivity and physiology so that the pain is not as great. And oftentimes we see that with shockwave therapy is patients, although the treatment's painful, afterwards they do not have as much pain as they had beforehand. Now if we look at the research of shockwave therapy, which has been around in the United States for 15 years or more, there's a lot of studies that have been done. The problem with shockwave therapy is it's very difficult research to do, and here's the reason why. When we do shockwave therapy, we want to cause pain, we want to cause injury. And so to have a blinded study, you can't do it because the patients won't feel any pain, so they will know that they're not actually getting the treatment. The other thing that complicates the research is we don't know how many impulses to deliver. We don't know how the frequency of those pulses should be. We don't know how frequently to repeat the treatments. And so it makes it a little bit difficult. So there's a lot of back and forth in terms of doing the treatments with shockwave therapy. If we look at the studies that have been done, there are studies looking at shockwave treatment for plantar fasciitis, medial and lateral epicondylitis or tennis elbows and golfer's elbow, rotator cuff tendonitis, Achilles tendinopathy or Achilles tendonitis, patellar and quadriceps tendonitis, hip tendonitis or the gluteus medius tendonitis that some people call greater trochanteric bursitis. There's also studies showing that shockwave therapy can benefit fractures, broken bones that are not healing, whether that's a stress fracture or a traumatic fracture or a delayed union. Now in addition, we treat a whole lot of other conditions with shockwave therapy because it seems to help a lot of people, whether that's a bursitis. There's some studies that have looked at avascular necrosis that show that it might offer some improvement. It's also been used in apophysitis, and apophysitis are those growth plate injuries that occur in children, and we can stimulate a healing response in those with chronic pain related to that. It also works for proximal hamstring tendinosis or tendinopathy, which is a very difficult problem to take care of. It works for other insertional tendinopathies, and then another common use in the sports medicine world is to treat acute injuries. And this was discovered almost accidentally when we treat athletes who have an acute groin strain or muscle strain with shockwave therapy. While it's very painful to do the treatment, it seems to stimulate a better healing response than if you don't add this to the mix. So that's another group of patients besides the chronic tendinopathies and tissue breakdown, but also the acute muscle injuries. Now, what are the side effects or the adverse effects of shockwave therapy? Well, the first one is pain. It hurts to do the treatment. And we adjust the pain level or the energy level based on how the person responds to the treatment. But people can become nauseous, they can get back pain, they can have episodes of fainting, what we call a vagal response. They can get joint stiffness, you can get nerve injury and radiating pain and numbness related to the treatment. But for the most part, it's very safe. It takes about 6 to 7 minutes to do the treatment, and generally afterwards people have an anesthetic effect or a numbing effect, improvement in flexibility that lasts for 30 minutes, 12 hours, a few days. Everybody's a little bit different, but that's the response after the treatment. Now, some of the precautions that I use with patients in terms of whether they should be a candidate or not, first of all, if they have a very low pain tolerance, they're not a good candidate for shockwave therapy. If they can't really localize the pain very well, if they don't have an obvious injury, sometimes it's not indicated. Pregnancy, probably not a good idea to treat pregnant women. Although it's not recommended for patients under the age of 18, I've treated plenty of patients under the age of 18 with shockwave therapy without any adverse effects. You have to be careful in people who have implantable devices, like implantable bone stimulators, implantable spine stimulators, pacemakers, cardiac lead wires, those sort of things, because you don't want to be damaging those structures. The other thing is if they have a deficiency in vitamin D or thyroid or iron, those people don't tend to respond as well, so usually we have to make sure that those levels are back to normal before treating. If the person's on blood thinners, Coumadin, if they have a bleeding disorder, they can sometimes have worse bleeding from the treatment because we do cause a lot of tissue damage. And while it's recommended to use caution in people with open wounds and infected skin, the shockwave therapy may actually stimulate healing response in those areas. So in summary, shockwave therapy is another one of these regenerative techniques that can be utilized to treat a variety of chronic pain conditions due to tendinopathies. It's also beneficial in high-level athletes for treating acute injuries and seems to allow for a more rapid recovery and return to sport participation. Now certainly there's limitations of the research, but it seems to be an effective tool that we'll oftentimes utilize before undergoing surgical treatment. That's a summary of shockwave therapy, and please check out the links below for further information regarding shockwave therapy and other regenerative techniques. Thank you.